nonprofit organizations that provide application assistance in San Diego, California. And in California, the term for SNAP is CalFresh, and the term for Medicaid is Medi-Cal. And now what some of you may not know is that California has the lowest CalFresh participation rates in the country, and then out of the 58 counties in California, San Diego County has the lowest CalFresh participation rates. And so my organization, as well as many other anti-hunger advocates in California, really saw the rollout of the Affordable Care Act as a historic and unique opportunity to increase CalFresh participation. So what do I mean when I say integration? What I mean is that there are a lot of organizations that provide just CalFresh application assistance, and then there are a lot of organizations that just provide Medi-Cal application assistance. But wouldn't it be great if all organizations provided both programs? And so that's what integration is. It's just when one organization provides both CalFresh and Medi-Cal application assistance. So why is integration important? Integration eliminates the duplication of paperwork, effort, and time of clients, organizations, and program administrators. Integration also increases the likelihood that clients in need of both programs will get assistance. Integration also reduces or streamlines and reduces the stress of applying and enrolling for clients. And lastly, integration, or the access to both programs improves clients' overall health and well-being. And as you can see from this diagram, health and hunger are intrinsically linked, and food insecurity has a lot of negative health impacts on individuals. So there are three really good reasons why now is the time to integrate. Due to two new laws, one federal and one state, and additional and also new funding that's available, the opportunities for integration have never been greater. So first, due to the recent expansion of Medi-Cal under the Affordable Care Act, people who are newly eligible for Medi-Cal are likely to also be eligible for CalFresh. And this diagram shows the overlap of eligibility for the two programs after Medi-Cal expansion, and so as you can see, there's quite a bit of overlap. And there's also, under the Affordable Care Act, there's new funding available for application assistance. And then finally, the state legislation that has been enacted January of this year is expanding CalFresh eligibility specifically for households receiving Medi-Cal. So it was my job to figure out how integration works best for clients, organizations, and program administrators. And so I conducted 25 interviews with program managers to figure out how they were providing CalFresh and Medi-Cal application assistance. And while I identified several versions or types of integration, what I found works best is when one client receives application assistance from one application assister with one application. And this may sound intuitive, but it's hard for organizations to do both because providing two programs requires additional staff time, funding, or training and funding. However, organizations are better able to meet their mission of supporting the health and well-being of clients. So if an organization cannot reach this ideal type of application assistance, there are some ways that organizations can get as close to it as possible. So organizations that are not currently taking advantage of federal and state funding sources should inquire and consider doing so, because these were the most common types of funding organizations reported, organizations who integrate reported. Also, even though this is not the most ideal scenario, organizations that just provide one program can host application assisters from a partner organization that provide the other program, and they can host them on site. Funders are also interested in the link between hunger and health, and they understand that many individuals need both nutrition assistance and health insurance. And so that's why we have recommendations for funders too. So funders can support clients at every stage of the application process, which is really crucial to the success of application rates, or successful application rates. Funders enable organizations to best serve their clients through their willingness to fund robust and comprehensive programming that supports clients from the start to finish, which includes outreach, pre-screening, application assistance, and then follow-up. Funders can also provide matching grants to draw down federal funds and cover important program costs that are not covered by government grants. And then just in summary, integration is a really innovative way to streamline two federal programs. And since the need is greatest in San Diego, organizations should really take advantage of the opportunities that the Affordable Care Act has created to integrate. And what that is, once again, is when one client receives application assistance from one application assister with one application. Thank you.